Many of us have experienced the pain of watching loved ones suffer and die, and it's normal to fear suffering at the end of one's own life. But changes are not needed in order to effectively treat severe pain. It is entirely legal for a doctor to administer as much medication as is needed to relieve a patient's pain and other symptoms, even if such medication hastens the patient's death as a side effect of that treatment. If a patient were to die as a result of the medication, the doctor would not be at fault because their intention was to relieve the patient's symptoms, not cause their death. It is the same as a patient dying in surgery while being treated for a life-threatening illness or injury. The importance of intention comes from thousands of years of established medical ethics, which have maintained the principle that it's unethical for a doctor to kill their patients on purpose. Euthanasia shatters this principle. Euthanasia makes it allowable for a doctor to intentionally kill their patients in certain circumstances with a fatal dose of drugs. This is why the World Medical Association and the medical associations of most countries around the world, including New Zealand, oppose euthanasia. As the Australian Medical Association stated, doctors should not be involved in interventions that have as their primary intentions the ending of a person's life. Euthanasia requires modifying the definition of healthcare to include intentional killing, categorizing euthanasia as a health service to legitimize it, making it somehow sound safe. As people generally trust health professionals, euthanasia soon becomes more acceptable simply because a doctor is doing it. But all over the world, most doctors do not want to be involved in euthanasia. Labeling intentional killing as healthcare creates some disturbing consequences. The first of these involves money. The problem with calling death a medical treatment is the fact that one-off fatal overdoses are a lot cheaper than complex ongoing medical treatments and care. So it's no surprise at all that some terminally ill people in the US states of Oregon and California were told that their medical insurance won't pay for their chemotherapy, but it would pay for a deadly drug for assisted suicide instead. The second problem with calling death healthcare is that it can be advertised as such in hospitals, medical clinics, waiting rooms, and in the media. New Zealand and the United States allow direct-to-consumer advertising of prescription medications. So imagine ads coming up shortly that will say, "Ask your doctor if assisted dying is right for you." People struggling with depression and suicidal thoughts could be triggered and encouraged by such ads. And terminally ill people who may otherwise have never considered euthanasia would be confronted with this decision on top of the huge burdens that they already face. A third problem, when euthanasia is offered as just another treatment option, there is increasing pressure on health practitioners to be involved, even when they don't want to be. Is it right to force doctors to be involved in a medical system that condones intentionally killing, contrary to established medical ethics? See, only 17 New Zealand doctors have signed an open letter in support of euthanasia. By contrast, more than 1,500 New Zealand doctors have signed an open letter saying no. The no letter ends with this request: leave doctors to focus on saving lives and providing real care to the dying. Euthanasia and assisted suicide have serious negative, unintended, and often overlooked consequences. We cover these in our other videos. However, one of the most disturbing negative effects on the society comes from changing the definition to include the intentional ending of life. This radically redefines established medical ethics in most Western countries and undermines the doctor-patient relationship. Dr. Sinead Donnelly, who specializes in caring for terminally ill people, says the practice of euthanasia only involves doctors to provide a cloak of medical legitimacy. Killing is not caring. She goes on to say, please leave doctors out of it so that we can focus on caring for our patients. If you enjoy our videos, please support us so we can make more like these. Visit support.thinkingmatters.org.nz, and while there, check out our other resources and events. Ngā mihi nui.